talking about those numbers, let's look at how exactly they're stacked up in major metros and cities across the country. You've got the chart on your screen that talks about hospitalization in major cities. In Delhi and Mumbai, for example, there is at the moment a sharp fall in COVID cases. But if you see between January 11th to January 17th, you see Mumbai hospitalization actually go up from 7.24 to 11.08. In Chennai, it's actually come down. In Delhi, also it has gone up. In Kolkata, it's come down slightly. In Noida, it remains almost the same. In Gurgaon, also it remains roughly the same. This is coming to us at a time when numbers are reflecting a different figure. If we come to that next. Now, Delhi and Mumbai have seen a sharp fall in COVID numbers, but uptick in hospitalization, like we said. Hospitalization is inching up in Delhi NCR as well, and it has almost crossed that crucial 10% mark in Mumbai.
Doctors and nurses around a COVID patient in Delhi. The hospitalization rates and rush are so far nothing like what was seen in the horrific second wave. But health officials are closely tracking this. NDTV analyzed the hospitalization numbers in the last 7 days, which has seen over 17 lakh cases. In Mumbai and Delhi, hospitalizations are seeing an uptick, even though cases have now fallen for several days consecutively. In Mumbai, it is up from 7% to 11%, and ICU rates have more than doubled to over 6%. 11% is just outside the 5 to 10% band that the Health Ministry had reported last week. However, the hospitalization rates from other states are still within this band. In Delhi, the uptick is from 2.9% to 3.2%. Although the ICU rate is marginal, it is still seeing an uptick from 0.7 to a shade under 1%.
So we need to keep a close watch. If the hospitalization rates are plateauing, are decreasing, it clearly confirms the declining trend of COVID positive cases in the country. But if the hospitalization rates are going up, then we have to increase the containment measures. We also have to look at the percentage of hospitalized patients requiring ICU care, because that clearly reflects the disease severity.
In fact, there is a dip in Kolkata despite as many as 1 in 2 tests turning up positive, and in Chennai the dip is more, from 8 to 5%. At the Guwahati Medical College and Hospital, the largest COVID care facility in Assam, occupancy of beds has gone down from 29% to 16% in 1 week.
So as a whole, these patients, as of now, who are admitted, are less on oxygen, less on ICU care. No patients are, only I think one patient now is on NIV. The rest of all the patients are on, in ICU are on or just simple oxygen. So as a whole, the symptoms which is being shown is more of the Omicron variety than the Delta variety.
During India's second wave, hospitals across India had run out of beds and even other basic resources like oxygen. And that is why this time the government as well as experts are repeatedly pointing out that we cannot let our guard down. Bureau report for NDTV.